Do you know what all points to be remembered or to be noted while doing a renewal of your health insurance? If no, then this video is for you. Do you know that you need to renew your health insurance every 1 year or 3 years? But what all points to be noted and what all points to be checked while you're doing the health insurance? If not, then this is the video for it. If yes, also still you watch this video, because this video will give you the best of all the ideas what you can do for renewal of intelligence. Hi, this is Maheshkathiravan. I'm the founder of FinLit Academy, and I'm on a mission to help 1 lakh working professionals to be financial literate and make them achieve financial freedom. Now, in this video, today I will be showing with you and sharing with you my 7 pointers which I shared, which I implemented with my clients in my personal life as well while doing the health insurance. Now, before that, let me get back to you. When you purchase a health insurance, you have to pay the premiums every year to keep the policy active, right? But most people don't do a thorough review of the health coverage requirements periodically, because this is very important. Every year your health changes a lot, and because of that your lifestyle also changes a lot. You sometimes you don't eat so much, but over the course of the time you eat so much. So these are some of the things which you are changing your health. But what happens is that you never look at the health insurance. You just blindly renew the health insurance plans. Now, this is not the right approach. The renewal is your chance to review your health coverage, and this will come only once in a year or once in 3 years, whenever your renewal will come. And that is whether sufficient or not, you have to check it, because you are the one who have to pay the premium. Don't look at the premium part. Premium part is one of the thing, but there are many other factors which I'll be sharing with you, which will be sharing with you the details of that, which you will be finding very useful. And making a note of it, get in touch with your health insurance advisor and make a note of it. If possible, if not, then get in touch with me. There is a link for your Zoom call. You can click on the discovery call session of 15 minutes, wherein you can ask your doubts and I will solve with you for free of cost. No worries at all. So let's jump into topic. Okay, thank you so much for coming back. Okay, so today I will be sharing with you the 7 pointers to check for the renewal of your health insurance. Now, coming back to the thing, what all the things we have to note. The very first thing is that sum insured. This is very, very important, because if you see, sum insurance is really a very important thing. And when I say sum insurance, it's not about the total amount. It is there, it is one of the part. But let's say 5 years back you took a health insurance of 2 lakhs. Okay, now since then you got married, you had a child. Do you think today the 2 lakhs will help you? You know the answer. And what I'm saying is that sum assured is only one thing which major of the people are looking at. Don't look at that one point. There are many factors are there. See, sum assured is very important, because you need to realize that how many people you are getting insured. Now, if it is for one person, is okay, no worries about it. But there, if 2 persons are there, husband and wife, you have to think twice, because women-related diseases are very, very difficult. If they come post certain ages, they are very difficult to entertain or their treatment. So it is very, very important that you need to look at that angle as well. When you do get an insurance, or you are doing a review of the insurance, you need to get the sum insured very, very checked. Now, the second point, when I'm talking about, is this point. This point is very, very important, is the inclusion of your family members. Now, this is very, very important, because when I say that inclusion of family members is there, this is very, very important. Now, many times I can share you one story of one of the client, and he was 2 to 3 years back. He had a wife and he had parents as well. Now, what has happened was that while he was working, then after that he started a business. So while he was working, he had got his corporate policy, and corporate policy was included his parents as well. One of parents, and one is immediate family member, and his wife. So that was the condition which the company has laid out. When he was around sum insured for about 3 to 4 lakhs. The premium was very less because it was coming from the company. So they had an agreement with the health insurance company, and that's why they did the things. But what has happened was that when he left the job, his health insurance became zero. And when he started a new insurance policy, that's where the heart attack happened. No, I'm not saying the real heart attack. the mindset heart attack. He really got pissed. He really got very, very worried. What is happening right now? Because the premium which he was paying very, very less, but now suddenly when he came on as an entrepreneur, as a businessman, suddenly left his company, the premium shoot up very well. And when he tried to include his parents, it was very, very high. So my suggestion is that whenever you want to include your parents, I would suggest that you take a separate policy for your parents, because parents' age is very, very high, senior citizens kind of thing. So don't include them here, because your age, always the health insurance, sum assured and everything premium is calculated based on the highest age. So that is very important. So your premium will be calculated only on your father's or mother's age. So take them and give them a separate policy, and then you and your wife and children get it into a simple policy. Okay, so this is the inclusion of family members. So you have to clarify, statistically decide how you can include your family members, because at certain point of time you need not include, at certain point of time you need to include. But who is suggesting that? Your health insurance advisor can suggest that. If you're not able to get an idea, to get in touch with me, I will share with you what exactly this all things about. Okay. The third thing is that personal details. Now, many of you know email ID today's in digital age and post pandemic, it has become a necessity. Without email ID, you can't do anything. You have multiple email IDs, that's okay. But one of the email IDs which you're using for your health insurance and all your investments, be careful to store that password, or to remember that password at some point of time, and share it with your family members as well, so that at any point of time when you forget, your family members can help you. But it is only for the immediate family member. Don't share your password with any of your friends as well. So check whether your first year you might have changed your address, you might be staying in your rented house, or you might be staying in some other locality, you changed a lot. Whether your address is current address or not, that you have to check. If it is not, get it done. Email ID, you have to check it. If your email ID is done, it is not, then that means your email ID is not correct. So you have to again go back and check that whether the email ID is not. Now I tell you an incident of one of my referrals which was come to my one of the client. Now, what has happened was that he had renewed for 3 years, and unknowingly or knowingly, I don't know what was the status, he had updated his old email ID. Now all the premium receipts and all the updates of that insurance company was going to his old email ID, which was closed for about 2 to 3 years. Now he doesn't remember the password also, and the username was, what was the email ID as well. Now, what was happening was he was not able to get any updates, even though his mobile number was there. But the mobile number, only some updates are coming by the, probably you might have checked on the options or something might have done. I don't know exactly what has happened, but this is what he was communicated to me when I met him to a strategy call session. The point I'm trying to make here is, see, whatever the challenges are there, you should remember the kind of personal investment products you are investing, and whether you are investing in the right way or strategic way. Now, if you are doing these things, you need to remember the password, the username, the email ID, the mobile number, whatever personal details you are sharing, your PAN card, Aadhaar card number, you should remember and keep it in some place where you can remember or reside every time. This is really very, very important, because this informations are really good. Now coming back to that story of my client, what has happened was that after 3 years his policy was on renewal, and boom, he could not do anything, because he could not submit his IT returns because of the medical premium certificates. That also you can, the issue is solved because you can do it by logging and everything. But the problem was that his email ID was not able to retrieve, despite many attempts tried by the medical insurance company as well to get him, because see, they don't know the person. Okay, they have many clients at their junction. Now, if you want to verify, they have to verify with some of the steps which you are given. So they have their email ID, mobile number, address, and everything. But every time that that person used to call the call center and used to verify something or other, he used to miss one thing. And because of that, they were not able to verify. So after 3 to 5 attempts, health insurance company finally said that, sir, it is not possible. You have to do a written complaint, and you have to check into that why exactly, what is the issue, and then only we can come to know. The final update was that his email ID, it was just a little bit difference of his letter, which resulted in the miscalculations and the miscommunications between him and the company. And that got rectified. Now it has been done. But you imagine the kind of trouble he was at the hospital. He wanted to reimbursement things. He wanted to do cashless statements. He can't do anything because all the communication were going to that email ID, which he was not able to access. So the hospital people was also not knowing what is happening. Yeah, so this is very, very important that you need to note down these nitty-gritty issues and nitty-gritty informations as well, because if you go elsewhere also, you will be not in a good position to help, because this information is only and only used by you. Now when I come back to the fourth point, the fourth point is nominee name. Now, this is very, very important. Why this nominee name is, time again and again, I always tell to my clients as well, all the people whom I met and my shares and my blogs and everything, I always share that come what may happen, you need to have one nominee with in all your personal documents. Now, irrespective of what is the operation and what is the operative part of the nominee, that is a different thing that you can mention in will, or you can check out with the service provider who is giving that services and everything. The main objective of nominee is that if you are gone out of this world, if you are not there in this world, what will happen to that savings or interest of that particular investment product? If the answer you have found out, there is no need of nominee. But if you have not found out, the nominee should be there should be documented, because if you're not documented, nobody will else know. And the investment product manager or the company whom you are buying the products, including the health insurance, they will never be able to do something or help you out. So this is very, very important that you have you had it in the previous policy or nominee? If not, please, when you now renewal, or if you are doing now also, you can update your nominee. It's not mandatory that you have to wait for that year renewal. No problem, you can do now also as well. Contact your health insurance provider and get it changed. That is really very, very important thing. Okay, so I can share one example of one of my one of the strategy call session, free session, and that person have not joined in my community, but he was just sharing his story and related this nominee. It was a very important thing. Now, when he was not married, he was having a nominee as mother in his health insurance policy. Now, when he got married, he got another policy where he named his nominee as wife. So what has happened when he left that company? So he switched off to another company. So that company was having the mother nominees, and by mistakenly or unknowingly, what he has done is that he thought that policy was valid because he not got any communication from the health insurance company nor the company, and he thought that the policy is going on. Okay, so this is some of the things which normally client doesn't remember or understand. And when he got another policy, he renamed the nominee as wife, as well also his wife for everything. Now, when his mother got admitted, he got back to that policy. The policy company told him that this policy is already expired, because since he left that company, that policy has ceased, and there is no other insurance which was left for his mother. Now, what has happened? He came from his pocket, and it was literally around 4 to 5 lakhs. And that point of time, literally, he has just switched job. So he was in a new job, just first day or second day, and this has happened, and he has to pay 4 to 5 lakhs from his pocket. Now, can you imagine such a situation where you're living in a urban city kind of thing like Mumbai, Delhi, Kolkata, where the high cost of living, medical cost is also high, and you're thinking of putting your mother in a very good hospital, and right now you don't have anything. So this is really very bad situation, especially in the health insurance and life insurance. So don't make these mistakes, because these mistakes really cost you a lot. So nominee is really very important thing. Now, how do you create a nominee? What is the process of nominee? You get in touch with me. I will share with you what are details, or get in touch with your health insurance advisor how to get it, because nowadays it is all online. You can do it. Some of the health insurance providers are providing that, or else you can go to the office and update it, or you can get in touch with your advisors to get it done. Great. So till now you have been understood what are the 5 conditions are there. Now, 4 conditions are there. And these 4 conditions are really very important. I'm coming back to the 3 more pointers. Before that, these 4 pointers is really very important, because you need to understand where exactly you are renewing your health insurance and what are the points to be noted. Okay, so It is really very important that you need to understand these things. Now coming back to the fifth point. So the fifth point is your terms and conditions. So what is terms and conditions? Now terms and conditions are, it's really very finely printed, and you better know that any at today's age, if you go any side, you have certain terms and conditions, TNC, you just blindly do it and go it. Even an OTT platform like Amazon Prime or Netflix, when you go, they have a terms and conditions. There are some things are there which you never look at that. Possibly if you are a lawyer or from that perspective, a detective kind of thing, you really look at it. Sometimes I also look some of the terms and conditions which I am not comfortable, especially in the technology side as well. I get to know some of the things, but it is not really mandatory for any person to do that. I can understand to that. But now when you renewal, this is very important because insurance sector is a very dynamic, post pandemic, totally the whole sector got changed, even the life as well as health. And every year, every few minutes, new diseases are coming, new progress are happening in the research and development of science fields and everything, and new developments are happening in the health insurance industry as well. So it is really very important. There might be some mergers or some acquisitions or some insurance company shutting down or their shop, or they're drifting away, they're selling some assets or something. Something is happening in all insurance companies domain, and it's very difficult for a common man to keep track of these things. So the only way to keep track of these things is that whenever you renew, you come to a renewal year or the time, that's where you can check out the terms and conditions. Terms and conditions might be that they might be something which might be your existing insurer might decide to change a few terms of conditions of the existing portfolios or the policies in the name of upgrade. They can do it. So you don't have any right, but you have a right to close that policy and get a new policy. But you have to first ask the call center or the health insurance advisor of that company and ask for the clarification why this upgradation been done and why it is not being communicated to you as a client. That is very important because as a customer, you need to know this first-hand information is very important for you to know that. So this is very important that this might need to increase in coverage as well as increase in premiums. That is different thing. But the major important thing is that what been excluded and why it has been excluded and why because of that. Is there a steep rise of premium? Is there a steep rise of sum assured? This you have to analyze. Because some of the things might be very tinily printed. You never know what is there in that. So it is really very important. During the first year, there's all things you have to do. If you don't have time, get it done with a paid financial advisor or health advisor, or get in touch with me. I have put that link, Google form link. You can just fill out and come back to me. Okay. Now the sixth point is network hospitals. Now this is really very important. Why network hospitals? Now I always say that network hospitals is really one thing which you always have to look, because see, everybody today loves comfortability, right? You don't want to step out of the years because that's what the pandemic has made us. Like for 2 years we were sitting in home only. We are still feeling lazy to go out. Yeah, but due to the work we have to go, to the business we have to go, but that is also, our mind says that don't go, but our body says that we have to go because we have to earn. Okay, but leave us at that part. But going over the tendency, if you see, many people like to work at home, so and they feel very comfortable because of all these things. So the very basic thing is that whenever you speak about this term network hospital, always see that which hospital is in vicinity or in your area around 15 to 100 meters. Now this is approximate figure I am giving because this was the analysis and discussion I had with my clients. So this is my personal perception. Don't take it as a granted. Okay, this is a disclaimer. Please understand this is a disclaimer. Okay, you can get it checked with your own research. Wherever you're staying, whatever hospital you are comfortable, you think that hospital is very good, you go for it. Okay, so it's nothing that hardcore fast rule that you have to check the hospital within 100 meters. No, it's just an example or just an analysis which I shared with you. Okay, so many people go for this kind of things so that whenever what has happened, they can carry it. They can't call the ambulance, and there is no need because the ambulance will come again, take some time. Then what will happen in that between time, whether the patient will lose or not? So this is very important. So the network hospitals always are very important. So based on the above changes like terms and conditions, many people, many health insurance providers just change the hospital because they have a tie-up with this hospitals. Okay, so this is all money related things. So they have a tie-up with the hospitals. Now hospitals give some things to the medical insurance company and medical insurance give that. So that is a tie-up. Now when that tie-up reach to certain level where they are not able to sustain, or they feel that some other competitors coming, because a lot of competitions are there, so they go for closure of that particular relation. And sometimes health insurance companies close that, or sometimes hospitals doesn't want to continue the relation because of some bad uh, event happening in their life. Okay, so this is very important that you need to understand what is exactly happening in your network hospitals. So if you come to know, how you will come to know, there are a list of hospitals which is updated in their list, okay, in their website. So you can check out their website and check with them, or else you can contact their paid health insurance advisor from with whom you are taking the policy, get it done. They will give you a list of network hospitals. Okay, or if that is also not there, you can check your call center and get it done. Okay, now if that is also not there, and after the 1 year you want to renew your policy, so always check whether your nearby hospitals are there in your network hospital. If that is not there, then again get it confirmed with the health insurance why that is not there, why that is not there. Some specific reasons will be there. If you find that reasons are valid, is logical, go with what you feel, because I'm not the one to judge you or correct you, because you are the best judgment, because you know your place better than me. Okay. Possibly you're living in Delhi, you know where Paschim Vihar is, Paschim Vihar, no Chanakyapuri, where you know. So Chanakyapuri, you know everything because you since born and birth from Chanakyapuri, you know, or you know Delhi in and out. So you know which hospitals are good or hospitals are not good. So it's better that you take the decision so that you can go. But this is a point very important, but that you need to remember while you doing these things. Okay. Now the seventh point, the last point, is research. Research, I will never say don't stop. Don't stop. Even if you don't feel time, and if you don't have time also, don't worry about that. Get it done from with your health insurance advisor. But always remember that health insurance providers regularly upgrade their existing policies and they announce the new ones. Okay, now many new plans will offer benefits which might be useful for you but might not be available in your existing health cover. Now how do we come to know that? See, that is what I'm saying. It is very dynamic. They will change the existing policies, some remove, some addition will be done. They will bring out the new products, because these people are always doing new products, creating new products. It is always lying at the government, this thing, the regulatory body, and they often have their own reservations and everything, and post the reservation, they approve that product. So when the approval comes and product comes, it takes longer time. But over the course of time, it has totally changed the dynamic of health insurance. So the person, while he was having that health cover at 2015, assume that, and when he's going for the same policy at 2017 or 2018, might be lot many changes happen, because lot many changes are done in the health insurance sector. So in 3 years, it will take a lot of time to understand. So research is very important, because research will be very, you can get various websites like Policy Bazaars and everything, where you get aggregated of all the websites, all the insurance policy you can get. So you can pay, you can create a login and you can get all the details, or you can go to a common broker who have all the multiple insurance and they can guide you. Or, and I would suggest that personally, I suggest don't go more than 2 or 3. Literally, frankly speaking, see, more or less everything is same. Is only some of the things here and there are okay, but 2 or 3 hospitals is 2 or 3 health insurance providers are only okay. Policies are okay. You have to check, do the research, because more than you will get confused. Your mind will get confused. You don't know what to do and what to do. And at the last point, you will get any bad policy and you get stuck with that. So it's better that only 1 or 2, maximum 3. Do that comparison based on some certain parameters and check for that, whatever you feel it is correct. Okay, so it makes sense that, does it make sense to review your current policy? I think after listening to that, I'm sure that you will do it, right? So it is very important that you review your current policy versus what are options are available. And to conclude that many working professions are dependent solely on their employer insurance. Like I said, my client in the very first point. Okay, so that is what has happened. So don't depend solely on the your company insurance. Take an external cover. Just if you don't have that capacity to take bigger cover, don't worry about that. Just take a small cover, which will help you. As soon as you leave your company, that cover will help you. See what is happening now. The period between you leaving your company, that one day also your health insurance company will not help you, because they have seized your agreement. You have left your job, so they can't help you, because that is the part of the agreement. You can't fight for that. So that one day also is really very important when you buy that separate cover for your family. That will help you a lot. So it's not matter of the time and money, it's matter of life. In that one day, whatever will things happen, you never know what will happen. Okay, so if you have your own health cover, even then don't make the mistake of blindly renewal. Now this is again this video for you, so blindly don't renew. Watch this video again with a speed of 1.5x. That will again very good for you. So understand what are the 7 pointers are there, what are the things I've shared with you. Get it, take the notes of these things and get it checked with your advisor, or you want to do your own. Okay, now review your health insurance. Always I would suggest do it half yearly, because majorly normally people do it yearly. I would suggest 6 months, because right now so many developments are happening, so many lifestyle changes are there. Your sleep is gone, you are not able to fix, you are now the working hours also change, so you might be putting 12 to 16 hours. So many things are happening in your life simultaneously. So it is really very important that review your health policy and go for regular tests. Whatever test you are provided free, utilize that. Things which are freely mentioned in your policy, don't leave it, because that will not get carried forward. Yeah, some of the things might carry forward, but some of the things they might not carry forward. So use that things with your benefits to your family, so that you can know what is happening. You can know what is happening with your health, because health is wealth. If your health is there, you can move ahead. Okay, and if you're unsure about this, finally you don't know anything, these things are very very overwhelming. I think this, I can't do it, Mahesh. Fine, I understand that not every person can do these things. That is why the specializations are there, no? See, if every person would be a neurologist, who will be specialist, who will be the general physicians, right? So they are doctors are there in various domains, right? Same way, every field they have very expertise and everything. So don't worry about that. Get in touch with your health insurance provider, get in touch with your health insurance company, get in touch with your paid financial advisor as well, or get in touch with me. If you want information, I have pasted the link in the YouTube. You can just fill the Google form, click on the calendar link, you will book, and you can meet me for 15-minute session. I am sure that that session will help you a lot, because I will be giving you some more guidance and help you out in selecting you the best health insurance policy. Now, disclaimer, I will not suggest any product name, so please don't ask me what are the product names of the health insurance company. I will not suggest anything, because if I suggest, you go and do that. So don't go the assumptions of what I am saying. You do your research, because it's your money, so you have to know what you can do and what you cannot do. Okay, so with that, I'm trying to end this video. Message me if you want a detailed analysis of your existing health insurance plan. The link is mentioned in the YouTube. Now, still, if you're not subscribed, please subscribe. Click on the bell icon. You will get all the videos. And thank you for all the support. Since now I think I am having more than 100 subscribers across. Thank you so much. Gratitude from my heart. Keep loving me, keep watching my videos. I will be coming in a month, 1 or 2 videos I'll be posting. Please watch the videos and give your genuine feedback. That will help me a lot. Thank you so much. Have a great day. Do tune to this particular channel, because I'll be coming back with yet another video. Thank you so much, and have a nice day.